Today on Listen Up, caring about healthcare, when the ethics of caring for the unwell cause moral dilemma. That's next. Welcome to Listen Up, where we explore news from a Christian perspective. I'm Lorna Dewick. There's an old saying that goes, you don't know what you've got till it's gone. And that's particularly true of healthcare. And when good health goes bad, it can be costly no matter who's footing the bill. Here in Canada, a socialized medical system can make it easy to take healthcare for granted. Not so south of the border, where the debate over healthcare reform has gotten heated and ugly. Americans will spend an estimated $2.6 trillion on caring for their health this year, or about $8,300 per person. U.S. President Barack Obama has decided it's time for reform. To help us make sense of all the controversy, we're joined by Global Television's Washington Bureau Chief, Eric Sorenson. Eric, thank you for being with us.
My pleasure.
All right. Eric, I think it's important for Canadians to remember there is some forms of coverage in the U.S. You've got Medicaid for the elderly. You've got Medicare for those who are poor and young. But there's this 46 million people in the middle that seem to have no health care coverage. Who are they? What's their situation?
Well, they are all over the country, but they are largely in areas that are poorer. They have slipped through the cracks. They're just not connected to the agencies and the organizations that would allow them to find health care coverage. There are many young people that I guess are part of that as well, and for the most part, they're not needing it when they're young. Most of us take our health for granted at that point, but it's later on that they may be needing it, and many of those that are now needing it are finding they don't have coverage.
All right, and you've been at rallies, you've covered debates where it is astonishing the passion that has engaged over this. What is it that has America so riled up in its healthcare reform debate?
Well, I think first of all, healthcare is very personal for people. Your health matters. I think in Canada we often take that for granted because we know that if we go to the doctor or we go to the hospital, somebody's going to take care of us if we really need it. People in America, many of them, can't take that for granted. They may not be able to afford coverage. They may feel that their coverage won't cover them when they really need it. And so now what you're having here is a political debate about something that is very big and very expensive, and that people on the left wing feel that it's time for this country to join with Canada and other Western countries to provide basic coverage for all Americans. And you have others on the other side of the argument who fear big government getting bigger still and possibly raising taxes. And it's a big gulf between them, and it makes the debate very polarized.
But I don't hear too many saying they could care less about the 46 million or the people who die every day because they aren't getting health coverage. There does seem to be genuine concern about the most vulnerable. Is that not right?
No, I mean, you will hear from even those on the political right who don't much care for the debate or some of the reforms that are being put forward, that there is a need for reform. There's a recognition that the costs are going to go up even if nothing is done. So something needs to be done. There's a recognition that many people are not getting adequate coverage, but there's a big dispute as to how to go about doing that.
And there is great fear over public insurance, which we as Canadians take for granted, our universal access to public insurance. Why is the concept of public insurance such a fear factor for some of these voices in America?
The idea of public insurance that Canadians take so for granted, I think, shows one of the differences between Canadians and Americans when it comes to how they view government. It's not that Canadians are all pro-government, but they accept that there is a role for big government in areas such as healthcare. Canadians come to expect and embrace the idea of a collective good and collective coverage for all Canadians. It makes Canadians feel good about the fact that they know that anybody can go to the hospital, including themselves, and know that they'll be able to go and be able to afford to go and get healed for whatever may ail them. In the United States, there's more of a reaction that is against big government, and you can play that card and cause many Americans to worry, well, government's already too big, I don't want government in my life. If this is going to be about bigger government, and it's going to certainly cost more money, and a public option would certainly put government in play on this, then there are Americans who will be afraid of that and angry with that.
Eric, tell us, why do you think Canadians are finding this debate in America so fascinating? We're following it closely.
Yeah, it's true. I mean, first of all, I think Canadians are fascinated by big stories in the United States. It's a big next-door neighbor of ours, and whether it's the election of a new president or a balloon boy turning into a hoax, Canadians are fascinated with that. When it turns to health care, this is a very big issue here. It's the kind of argument that people's eyes might glaze over, but it illustrates the differences between Canadians and Americans, and it's something around which I think Canadians say, well, I'm actually proud of our health care system. And the fact that the Canadian system has been dragged into the debate here, and often in a way that denigrates the Canadian system, I think it causes Canadians to get their backs up a little bit. It's almost like telling them your hockey is no good, to say to Canadians, or to put ads on the United States that suggest that the Canadian healthcare system is no good. Canadians rebel against that notion that it's not a perfect system. There are delays that are certainly in place, but that they feel, by and large, they wouldn't trade for what exists down here, and that Americans are not getting an accurate characterization of what the Canadian system is all about.
All right, and President Obama has put a year-end deadline on this to resolve this, to get it through the House. What's your prediction on how this is going to be resolved?
I expect that you will have, I think that deadline is, they will attempt to meet it. I leave it to their abilities to pull that all together, because you have bills now that are in both houses of Congress that will have to be melded and brought together. You are probably looking at a final bill that will be a compromise of sorts that will not please anybody on either side, but it will be argued that it is an improvement over what exists right now.
All right. Eric Sorenson, Washington Bureau Chief with Global Television, thank you very much for being with us.
Great to be with you, Lorna.
When we come back, exploring the different perspectives in this debate after this.